World Health Organization has declared monkeypox a global health concern. WHO Director General Tedros Adhanom Ghebreyesus declared a public health emergency of international concern and a designation the body currently uses to describe only two other diseases, COVID-19 and polio. The World Health Organization has activated its highest alert level for the growing monkeypox outbreak. For more on this, we're joined by Professor Adrian Puren, the NICD's acting director. Professor Puren, thank you so much for your time. So I think many people, not only in South Africa but across the world, when they hear WHO highest alert level, they immediately go into a state of panic. What does the global picture look like at the moment to warrant that kind of alert level activation?
Yes, so this follows on a meeting I think that was held probably 2 to 3 weeks ago. In fact, there was consideration to declare it a PHDIC then, but they decided that they would simply observe the events in terms of the unfolding outbreak. But I would sense that given the greater widespread nature in terms of the numbers of countries and the numbers of cases, I think it becomes really important for the WHO then to have a coordinated approach to this particular outbreak, given that it is an unusual outbreak outside of the endemic areas. It then becomes really critical to galvanize governments, public health policy makers, and communities that are affected in terms of trying to limit further transmission of this particular virus.
What would this coordinated response entail?
So very similar to COVID, I think that there will be obviously guidance for in terms of the various communities, various countries, in terms of how to approach this in terms of the further transmission. And this could include, for example, focusing on communities that are affected and how they could, not simply, but how they could prevent further transmission, as well as looking at, for example, the introduction of, for example, vaccines or vaccinations within specific countries. I think that will be a bit more complex, and therefore focusing on targeting individuals. And of course, having access to the ability to make that diagnosis in order to lead to isolation and therefore prevent further transmission, but in a coordinated way rather than just each country trying to approach it in their own individual ways. In other words, similar to COVID, again, the discussions are around access to any treatments that may become available, and of course vaccines as well, if they were available, and how to distribute that. But we know that those are areas that are difficult to manage, but I think that would be the importance of these types of declarations.
What does the picture look like in South Africa currently?
Yeah, so each country will have to have its own risk assessments, and that's why I would think that those countries where there are the largest numbers of cases, for example, in Europe, Canada, the United Kingdom and the United States, certainly have provided access and have identified the largest numbers of cases. So that becomes really critical. For South Africa, I think the risk assessment still, I would think for the moment, is at a low level in terms of the general population. But again, it's important for communities to be aware that there is this particular virus in circulation, and that we create the ability to ensure that people have access to be diagnosed and access to that diagnostics. And I would think for the moment it will remain low. We've only identified 3 cases, but again, that means there is virus in circulation. Whether it's reached a dead end is not clear. So we really just still need to be vigilant and make sure that we encourage people who have those particular signs and symptoms, the skin lesions and so forth, to present, be diagnosed in order that they be isolated. And of course, contact tracing, at least for South Africa in this time, is really going to be critical in order to limit transmission.
So during the COVID-19 pandemic and those various peaks, we became very aware of prevention. So given how the virus transmits, its transmissibility and how the symptoms present, what kind of interventions, non-clinical interventions, are we likely to see put in place, perhaps not yet in South Africa, but across the world, to try and once again limit the spread?
Yeah, so again, it's really information about what this infection and disease is, and therefore how one needs to prevent it. So again, the respiratory route is probably not the major route. I think it's the skin-to-skin contact. In other words, individuals that present with specific skin lesions, the blistering and the maculopapular rashes, for example, those individuals who do present with those particular conditions need to present themselves to be able to make a clear clinical diagnosis and then to be isolated. And then if they find themselves within particular settings, isolation becomes very important, and separation of, for example, those individuals within the households in terms of the sharing of beds or other surfaces, for example, those separations become important, like bed linen, for example, bed clothes, for example. Again, that's where the virus can still be harbored and is still viable. So those within the household settings becomes really, really important. Again, it's important that healthcare workers that are faced with individuals who have those skin lesions, for example, again, it's important that they practice safe IPC infection prevention control. Is really important. Of course, South Africa is not in this current position, but I'm sure there'll be further discussions around access to vaccines, that those healthcare workers may have the opportunity to be vaccinated in terms of prevention. And of course, individuals who are infected go into isolation, but those that have been exposed may also then have access to vaccines. But I think that's later down the line compared to what we are faced with currently. So I think it's really around infection prevention control, around, as I said, individuals who present with lesions, be diagnosed so we can have a differential diagnosis, and then contact tracing is going to be really central to the South African approach in order for us to identify individuals so that they can observe, and if they develop signs and symptoms, that they can then access for diagnosis.
In terms of treatment, what kind of capacity is there globally at the moment for the treatment and for the vaccines as well? Are there developed vaccines yet? Is that something that still has to be developed specifically for monkeypox? What are we looking at?
Yeah, so certainly certainly the initial smallpox vaccine was seen as a useful vaccine. It still may be seen as useful, but there are marked side effects. There's certainly been further vaccine developments that are monkeypox specific. There are also antiretrovirals that are available. But again, the access to that, the nature and extent of the access to that is difficult to assess. And I think South Africa probably will have to, again, galvanize in order to ensure that they become part of a queue in terms of accessing those vaccines. The antiretrovirals as well. I think there are some one or two available, but again, access may well be problematic. So just for some context, so when you look at monkeypox versus COVID, they're two different diseases. And monkeypox in the main is disregarded. I know for the individual, this is not helpful necessarily, but it's really seen as a mild disease. If there's a long incubation period, a mild presentation in the main, and this will then heal. And a person who has fully healed, in other words, the skin has fully healed, no longer transmits the virus. And in fact, as we have often said, it's the close contact that becomes really critical in order for transmission to occur. So I think we have different scenarios. So from a clinical perspective, I think in the main, people will come through this 2 to 4 weeks later. It may be fairly unpleasant, so there's probably symptomatic treatment that will be required. And again, we've not seen case fatalities that have been previously reported for this particular virus and this particular clade. So I think it's really different in terms of what we've seen. So it's very different in terms of our situation with regard to COVID-19.
So a lot less need for alarm. Thank you very much for clarifying a lot of that. That was Professor Adrian Puren for the NICD. He's the acting director there.